In this video you will practice skimming and scanning, which is very essential for Part A, OET reading test. You will see a text now for a few seconds. Try to answer a question based on the text. What aspect of appendicitis is mentioned in the text? If you look at the first and last few lines of the text, they have mentioned about what causes appendicitis. So correct answer is causes. Now read this question. Now quickly find the answer by skimming the text. The correct answer is phacolith. Now you can see how paraphrasing technique has been used between question and the text. In question it is mentioned, inner cavity of appendix. In text it is mentioned the hollow portion in the appendix. In question they are saying usually, but in text it is typically. In the question it is obstructed, whereas in the text it is blockage. If you are thorough with synonyms and paraphrasing, it makes it easier for you to skim and scan. Now scan the text B. What aspect of gallstones is mentioned in text B? Treatment, diagnosis and differential diagnosis, complications. If you skim and scan through the text, in the first line you can notice they are talking about other disease which may have same signs and symptoms like gallstones. And differential diagnosis is the method doctors use to distinguish between two or more conditions that share similar signs or symptoms. Also in the paragraph, they have mentioned various tests like ultrasound, CT scan, MRI, and X-ray. So we can easily understand that in this text they are talking about diagnosis and differential diagnosis of gallstones. Now, skim and scan the text C. Remember, when there is no heading or subheading, you should read few lines to get an idea about what the text is talking. What does the text mention about? The information in text C is about treatment for gallstones. Now answer this question based on text C. Dash is used in a limited way along with other treatments for different types of stones. The correct answer is lithotripsy. Now you can compare question and text to notice how they have used paraphrasing technique. Now skim and scan text D. What is mentioned in text D? Text D is talking about Parkinson's disease, particularly treatment of Parkinson's. Now answer this question based on text D. Which medication is prescribed for increasing dopamine level by inhibiting its breakdown? The correct answer is enzyme inhibitors. Check carefully how paraphrasing has been done between the text and the question. Finally, I am going to give you important tips and strategy for skimming and scanning. When there is no heading or subheading for the given text, read the first and last sentences of each paragraph. These usually contain the core idea or summary. For example, in this text you can notice it has been mentioned about ultrasound and X-ray for gallstones. So we can conclude that the text is about diagnosis of gallstones. Look for keywords and repeated terms. Scan for medical terms, drug names, symptoms, or conditions that appear frequently. They often signal the main topic. Use visual anchors. Even without headings, things like bullet points, italicized terms, or bolded phrases, if present, can guide your eye to key info. Mentally label each paragraph. Even without headings, assign a quick label like diagnosis, treatment, or patient history to help organize your thoughts. Underline keywords in the question first. Know what you're looking for in names, dates, drug names, symptoms, etc. Look for synonyms and paraphrasing. OET loves to reword things. If the question says high blood pressure, the text might say hypertension. Scan vertically and diagonally. Don't read line by line, let your eyes jump across the page. Bonus tips for OET success. Time yourself during practice to build speed. Use elimination if a paragraph clearly doesn't contain the info, skip it. Stay calm, the more anxious you are, the slower your eyes move.